student from LPU St. Cabrini School of Health Sciences. So today, I want you guys to learn something new from me because I will be doing a return demonstration about the proper procedures and how to administer a subcutaneous injection. But first, let us talk about what is subcutaneous injection. This is administered into the adipose tissue layer just below the epidermis and dermis. It is highly effective in administering medications such as insulin, morphine, diacetylmorphine, and goserelin. Common sites are the outer aspect of the upper arm, abdomen, anterior aspects of the thighs, upper back, and the upper ventral gluteal area. And now, let us talk about the purpose of administering subcutaneous injection. First, to get a rapid and systemic effect of the drug. Second, for some medications that cannot be administered orally due to the poor absorption of the gastrointestinal tract. And lastly, it is administered when the drug is toxic and irritating to the gastrointestinal mucosa. At first, you must prepare the medication or solution. And always compare the precision orders with the MAR. Preparing medications ensures patient safety with medication administration. But oops, don't forget to perform a hand hygiene. And then, gather your supplies. To prevent the spread of infection and organization facilitates accurate skill performance. Good day, ma'am. Your name, please?
I am Irene Malonas.
Okay, good day, Ma'am Irene. And this is Aria, your nurse for today. And I will administer you via subcutaneous injection in order to get a rapid and systemic effect of the drug. So, just simply relax and please cooperate. And if you have any questions, don't hesitate to ask me. Thank you. Explaining rationale increases the patient's knowledge and reduces their anxiety. And then, close the door as well as the curtains. This provides patient privacy. And then, compare MAR to patient wristband and verify this is the correct patient using two identifiers. Ensures accuracy of the medication or solution and prevents errors.
And yes, assess patient for any contraindication for the medications.
Assessment is a prerequisite to the administration of medications.
And don't forget to don disposable gloves.
Gloves help prevent exposure to contaminants.
And then select the appropriate site for administration. Assess the patient to the appropriate position as required.
Site should be free from lesions, rashes, and molds. Choosing the correct site allows for accurate reading of the test site at the appropriate time.
And then, clean the site with an alcohol swab or antiseptic swab. Use a firm circular motion and allow the site to dry.
Pathogens from the skin can be forced into the tissues by the needle. Allowing the skin to dry prevents introducing alcohol into the tissue, which can be irritating and uncomfortable.
Remove the needle cap with the non-dominant hand, pulling it straight off.
This technique lessens the risk of an accidental needle stick injury.
And then, grasp or pinch the area surrounding the injection site.
The decision to create a skin fold is based on the nurse's assessment of the patient and the needle length used. Pinching is advised for thinner patients.
And then hold the syringe in the dominant hand between the thumb and forefinger. And yes, insert the needle quickly at a 45 to 90 degree angle.
Inserting quickly causes less pain to the patient. Subcutaneous tissue is abundant in well-nourished, well-hydrated people. For patients with little subcutaneous tissue, it is best to insert the needle at a 45 degree angle.
After the needle is in place, release the tissue. And with your dominant hand, inject the medication at a rate of 10 seconds per ml. And yes, avoid moving the syringe.
Keeping the needle steady helps keep the needle in place.
And then, withdraw the needle quickly at the same angle at which it was inserted.
Withdrawing at the same angle prevents tissue damage and increased pain at the injection site.
Using a sterile gauze, apply gentle pressure at the site after the needle is withdrawn. Do not massage the site, okay?
Massage is not necessary and can damage underlying tissue. Massaging after a heparin injection can contribute to a formation of a hematoma.
And then, discard the syringe and needle into appropriate receptacle.
Safety shields and needle guards help prevent accidental needle stick injury.
And yes, don't forget to dispose your supplies. And also, remove your gloves. After doing the procedure, don't forget to perform a hand hygiene, okay?
This reduces the risk of infection and the spread of microorganisms.
And then, document the procedure and findings according to agency policy.
Timely documentation ensures patient safety.
And evaluate the patient response to medication.
For it is important to evaluate the therapeutic effect of the medication and assess for the adverse effects. And that ends my written demonstration about the proper administering of subcutaneous injection. I hope you learned something new from me today. I hope to see you next time in my another written demonstration. Once again, this is Aliyah Piayaras, a nursing student from LPU St. Cabrini School of Health Sciences. Thank you for watching! Bye!